Hi, I want to talk about glutamate and how it affects the body and what drugs affect glutamate, thus treating depression. So there's a lot of talk about this because people have heard about ketamine. Ketamine blocks the N-Methyl-D-Aspartate receptor, which is a glutamate receptor. It is one of the few things that treats depression instantly. Someone could come in an emergency room suicidal, get an IV infusion or an intranasal ketamine, or get an IM injection of ketamine, and within an hour they're no longer suicidal. What ketamine is there's a left and right of ketamine. They took away the right, and S-ketamine is the left side of ketamine, which is what they use in this drug called Spravato. It blocks this glutamate receptor, and when you block that, it causes the neuronal chains or intersynaptic matrix of the neurons to reorganize in an antidepressant way. Too much glutamate, people become agitated or hyperactive. It's a good time to talk about the balance between GABA and glutamate. GABA and glutamate determine the climate of the central nervous system, and other neurotransmitters like acetylcholine, norepinephrine, serotonin, dopamine determine the local weather. So GABA and glutamate are the big ones. They determine like the set point of the whole system. Things that affect glutamate, blocking this one glutamate receptor, like ketamine does, treats depression. There's other drugs. Memantine, which is used for Alzheimer's, blocks that NMDA receptor, which is a glutamate receptor. Amantadine, which is used for Parkinson's disease, blocks that NMDA receptor. Dextromethorphan, which is a cough medicine, it also blocks the cough response in the medulla of the brain, but it blocks the N-Methyl-D-Aspartate glutamate receptor. There's a drug called Auvelity, and I've done a video on that. It's mixed with bupropion and dextromethorphan because you're getting increased norepinephrine from bupropion and maybe some dopamine increase, and you're getting blocking of glutamate. Glutamate has 4 receptors. It's the N-Methyl-D-Aspartate receptor, AMPA, kainate, and now there's a new one, delta. They all act differently, but the key one that we talk about in depression is the NMDA glutamate receptor, and the drugs I mentioned, memantine, amantadine, dextromethorphan, and ketamine, both S-ketamine and regular ketamine, help block that receptor, and they treat depression by causing a structural change in the neuroanatomy of the intersynaptic connections of neurons. Now, the GABA. What affects GABA? Alcohol affects GABA. Believe it or not, alcohol can raise GABA, but it also blocks glutamate. I guess that's why it's so sedating. But commonly known drugs that sort of modulate or stimulate or activate GABA would be like benzodiazepines, lorazepam, clonazepam. They act on the GABA receptor, mimicking increased GABA, calming someone down. Alprazolam, flurazolam, triazolam, those are all GABA mimicking type drugs. What else affects GABA? The calming neurotransmitter, glutamate being activating, and the GABA being calming would be barbiturates. Barbiturates were very big in the 70s. They were the biggest, one of the most prescribed drugs, but commonly known barbiturates, phenobarbital, that's used for seizures. Seconal, they use in anesthesia. Pentothal, they use in anesthesia currently. Butalbital, is used as a migraine medicine to help calm you down. Big problem with barbiturates. Yes, they raise GABA. For some reason, being on barbiturates for a long period of time and then stopping them suddenly could result in death. And that's why these drugs were dramatically scaled back and are used most of the time in one-time use. With the exception of using them for seizures, phenobarbital, it's the only time where we keep people on them. But in that situation, it's very important to taper people off. I also want to mention there's things that block GABA that I talked about, but there's things that prevent glutamate release that are totally different. You could block a glutamate receptor, but you can also prevent the release of glutamate. There's something called riluzole for amyotrophic lateral sclerosis, ALS, Lou Gehrig's disease. So that can prevent the release, and Lamictal, which is used for seizure, prevents the release of glutamate. So you have drugs that block the glutamate receptor, drugs that prevent the release of glutamate, and drugs that act on the GABA receptor, stimulating it. And you had to go through this, I think, because a lot of people are using antidepressants now with glutamate. People are talking about ketamine, right? How does it work? It blocks glutamate. People are talking about Auvelity, which blocks glutamate with dextromethorphan. And people are very commonly using benzodiazepines, which raise GABA activity, and thus throwing off the ratio of glutamate to GABA, so that there's more GABA and less glutamate, making you feel calmer. Barbiturates can do that. Alcohol can do that. Benzodiazepines can do that. That's just a little snippet on this. This is Dr. Mark Agresti. Thank you.